All right, we'll start here in another minute, give people a chance to find a seat. All right, why don't we start? Good afternoon and welcome. My name is Ryan Reisdorfer, and I am the Health Programs Manager here at the University of Minnesota. Part of my role is to make sure every year that the retiree medical and dental benefits get renewed, and we've just been through the process of wrapping all that up. When you came in, the center table behind the booth there, we had a handout that has the side-by-side plan summaries that are typically in the benefit guides that we send out. We will be mailing those benefit guides out, but we wanted something for you to have for today's meeting and something to look at. The sheets we handed out today do include the rates for 2019. So that's been a big question so far since I've been here. So what we're going to talk about today, I'm going to take very little time here, hopefully, and then we're going to have all of our vendor partners come and talk about their plans for 2019. As you may have heard, there have been some legislative changes in regards to Medicare, and since we have the experts in the front row here, I'm going to let them talk about that, and that's our purpose today, is help clarify any questions you might have with that. When we're done here, the vendors and the employee benefit department will be out in the lobby again for about an hour and a half to answer any individual questions you might have too. So, what we'll discuss today, something that's not on the slide but I thought was important to announce since I have everyone here or online. Oh, I should also mention too, please hold off on your questions because we are YouTube streaming this, so people who couldn't make it here today could watch it online. I would ask that you reserve the questions for the hour and a half afterwards when you can actually get some close face-to-face time with people. Our presenters have about 20 minutes to go through their updates, so there isn't we didn't build a lot of question and answer time in here for now. What I was starting to say is we do have one dental plan change for 2019. The University Choice dental plan will be discontinued starting January 1st, 2019. I do know that impacts a number of retirees. And so what our plan is with that is anyone who's in that plan currently, we are going to auto-enroll you in the Delta Dental Premier Plan. And the reason for that is that plan has national coverage. They have a national network of dental providers, so no matter where you live, you should be able to find someone in your area. So to get back to the slides, we're going to discuss give you an overview of the 65 plus benefit plans. So first, Debbie from UCare will come up, and then health partners. So it's in the order in which it's on the slide. They're all going to make a presentation. Enrolling in benefits, the good news is even though there are some plan design, I shouldn't call them plan design changes, plan type changes, if you stay in your plan 1 or plan 2, we're just automatically going to enroll you unless we get an enrollment form from you. So if you're not going to change anything, you don't have to do anything this upcoming year. But if you do make a change or want to make a change, we do need the form, which will be included in the guide, just like it was last year. It's in one of the back pages of the guide. You rip it out, fill it out, and send it in to us. Open enrollment questions. I am going to put a plea out for everyone. Our call center and our benefit specialists in there can help you with enrollment questions. What do I have to enroll? I want to make a change. What do I have to do? Those kind of questions. If you want to know what's the difference between Medica Plan 1 and Blue Cross Blue Shield Plan 1, do not call them because they don't have that answer. I would encourage you to call the vendors themselves. In your packets, there are 800 numbers and local numbers for those who live locally to call their Medicare people to answer all your questions. And you'll get a much better answer and less frustration if you call us first just to tell you to call them. So I would ask you to divvy up where you're going to call according to either an actual how do I enroll kind of question or make a change versus what's up with the plan itself. I think that's everything on my list. I'm going to introduce Debbie Holt from UCare and take it away from there. Thank you.
Thank you, Ryan. Well, good afternoon, everyone. Oh, this is great to see such a great turnout. I think there's like over 300 people here. So I'm glad to see that you're all here to get all your questions answered, and that's what all of us are going to be doing, talking and giving you lots of good information. Let's see here. To go to the next. There we go. My name is Debbie Holt, and I'm the Group Medicare Manager at UCare. So I'm pleased to be here. I've been working with the University of Minnesota for a number of years, and so probably have talked to some of you at some point or another. But again, I'm happy to be here and happy to see such a good turnout. A little bit about UCare. UCare has been around for over 30 years. And we serve over 80,000 Medicare members in Minnesota and western Wisconsin. We are local. We are on Stinson and Broadway in northeast Minneapolis, so that's where our local office is. We have a lot of folks that come and visit us there. We encourage that. We invite you to stop in and talk to our customer service representatives or talk to one of us if you have any questions, feel free to do so. One of the things that we're really proud of is on an annual basis, we have an outside vendor that does a survey to our members. So we're not doing the survey, the outside vendor is, and they're asking them all sorts of questions about UCare and how their services have been, how customer service has been, what their satisfaction has been. And we continually, year after year, get a 9 out of 10 overall score. And that's something that we're very proud of. We're a nonprofit insurer, and we have a Medicare Advantage contract. And you've probably heard a lot about that because there's been a lot of buzz in the news about Medicare Advantage and Medicare cost plans. UCare is a Medicare Advantage plan, and I put down here that we're not a cost plan just because so many folks have called us and said, what type of plan are you? I'm on UCare, what should I do? Are you a cost plan? Do I need to make a change? And we are not. We are a Medicare Advantage plan, but through the U of M, because you have so many options, you're very fortunate. There's lots of choices here and lots of plans that you'll be able to choose from, regardless of what type of program you're on today. Star ratings is very important to Medicare Advantage plans, and this is a Medicare quality program, and it's a 5-star rating system, and it's based on all sorts of different factors: customer service, managing chronic conditions, screenings, making sure that our members stay healthy and take advantage of these screenings and tests and flu shots, vaccines, and so forth, operational performance, and we continually have received from Medicare a 4.5-star rating. And that's something, again, that we're also very proud to maintain and look forward to keeping that 5-star or 4.5-star rating. Who can join our program? Well, all of you, if you're a member of, if you're a retiree from the University of Minnesota or a spouse of a retiree, and you have Medicare Part A and Part B. So Part A is the hospital insurance, Part B is the medical insurance, and you also need to be retired, so not actively working. You do need to continue to pay your Part B premium. If you're collecting Social Security, it comes out of your Social Security check. Otherwise, you can make arrangements with Medicare to pay online or have it deducted from a checking or savings. You do need to live in the state of Minnesota or western Wisconsin. We have 26 counties in western Wisconsin. So as long as you're a permanent resident and that's where you pay your taxes, you're eligible to join. And the only health stipulation that we have is that you don't have chronic or end-stage kidney disease, meaning you're on dialysis. And that's because Medicare has a special program for folks that fall in that category. So if you develop that when you're on our plan, we coordinate differently with Medicare. We don't push you off the plan. But in order to enroll in our plan, that's one criteria that you are not able to have, one health situation that you can't have. So the premiums for 2019, Plan 1 and Plan 2. Plan 1 is $312 and Plan 2 is $179. This is per person. We have flexible billing options. You can bill at home, or you can have it automatically deducted from a checking or savings. If you are a couple and one of you is interested in Plan 1 and one Plan 2, that's perfectly fine. You can do that. You don't have to both be on the same plan. And again, for UCare members, this is the time of the year that you can make a plan choice change. So if you're on Plan 2 and you decide you want to bump up to Plan 1, you can do that. This is the time of year to do so. We have a large provider network, very, very large. You can see this is just a snapshot of some of the clinics that we contract with: Alina, Fairview, Health East, North Memorial, the Mayo Health System, which is really important to folks here in Minnesota, Park Nicollet, and of course, the University of Minnesota Physicians as part of our network. Actually, and it should be on this slide, and it kind of missed it, we have 96% of Minnesota providers in our network. So it's almost hard to find a provider that's not part of our network. So keep that in mind when you're looking at the program. And I don't bring out a provider directory because it's this thick and nobody wants it. It looks like the old Sears Christmas catalog. Nobody wants that. Some of the benefits that I want to talk about, the highlight under Plan 1 and Plan 2, because there are some differences between the plans, and this is your time to shop and look at them. Primary care office visits, it's either a flat $15 or $20 copay. That's in your internal medicine or family practice doctor. Specialist office visits, that would be a cardiologist or ENT or something of that nature. Copayment is either $15 or $30. Inpatient hospital care, on Plan 1, there's no copayment. It's covered 100% if you had to go into the hospital. On Plan 2, you have a flat $200 copay. Everything else is paid for while you're there. You don't have to worry about that. Ambulance is covered either 100% or with a $100 copay, but preventive services are covered 100% on both plans. And this includes your physical exams, your eye exams, hearing exams, mammograms, PSA tests, immunizations like flu shots. We want to keep our members healthy, and we encourage this by covering these 100%. So we want folks to go in and take advantage of these services and make sure that you're staying on top of your own health situations. Emergency coverage. For folks in Minnesota, this can be really important if you're traveling. But let's start out with worldwide emergency and urgently needed situation. Whether you're here in Minnesota, whether you're in Arizona or out of the country, you are covered for emergencies. And it's the same co-payments at an emergency room, which is waived. The co-payment is waived if you're admitted, and then it goes to the hospital inpatient co-pay. If you're out of the country, we do cover you, because Medicare stops once you leave the United States. But we will cover you until you're stabilized, to make sure that that emergency is stabilized and you're on good grounds and you can get back to the United States. But let's say that you're in Arizona and you don't have an emergency, but you're there for a few months and you say, I've always wanted to go to this cardiologist that my friend or neighbor goes to. I'd just like to go check it out and see, maybe get a second opinion for some reason. You can do that. New for 2019 is called UCare Anywhere. And office visits, whether it's a primary visit or whether it's a specialist, and therapies, whether it's physical, speech, or occupation, are covered the same out of network as they are in network with the same co-payments. Currently, today in 2018, if you're out of the network, those services are provided with a 20% co-insurance. We're changing that to make it a small, flat co-payment to make it easier for our members to manage and to know exactly what they'll be paying if they are out of network. If you're out of network and maybe you have to go in and have some outpatient services, so it's not an office visit and it's not an emergency, you can still do that and have 80% coverage for non-emergencies outside of our network. The only stipulation that we have is that you're not gone more than 6 consecutive months, but you don't need to call us when you leave and you don't need to call us when you come back. It's based on the honor system. So I used to say that I wanted to be a UCare employee that followed all of our members to Arizona in the winter, but they wouldn't hire me, so I didn't get that job. But anyway, that is the stipulation, that you're not gone more than 6 consecutive months. So it's a great travel and emergency benefit. Some other benefits that we offer are diabetes care. Some things are paid in full. Insulin is paid as a prescription drug, which I'll go into in just a moment. Vision services, whether it's routine or diagnostic, they're paid in full. There's no copayment. There's also an eyewear benefit, $150 per year. You shop around, find the best deal, submit the bill to us, and we will pay you up to $150 per year. Hearing works very similar. Preventive and diagnostic are paid in full. There's $500 every 3 years for hearing aids. Again, you shop around, find the best deal, submit the paid receipt to us, and we will reimburse you. So it works very nicely, very slick. Prescription drugs, and this is where the plans can vary a little bit. So I put them on 2 different slides, Plan 1 and Plan 2. We're starting out with Plan 1. Number 1 with Plan 1 is this is a plan that you cannot get on the open market. You can only get it through an employer group like the University of Minnesota. So when you're looking and you're talking to a friend or neighbor and they say, well, how come your premium's higher than mine? Well, it's because you have a much richer benefit design. This is not available to folks that just come to UCare on their own to purchase a plan. It's only available through an employer group like the University of Minnesota. So there's co-payments, 10, 30, or 50, depending on the category of your drugs. The uniqueness about this benefit is there's no donut hole, no Medicare coverage gap. Has anyone ever heard of the donut hole with a show of hands? Yep, most people have. So this plan is rich and you don't have to worry about that. You just continue to pay your co-payments all year long. You can get a 3-month supply for 2 co-payments through mail order or through our preferred pharmacy. And our preferred pharmacy network includes CVS, whether it's a standalone or through Target, Shopko, Costco, Cub Foods, and new for 2019 is Sam's Club and Walmart. And we also have mail orders, so you have lots of different options. If you go to a pharmacy that's not preferred, you can continue to do that, but you'll pay 3 co-payments for a 3-month supply instead of 2. So again, it's unlimited prescription drug coverage. Questions are not going to, someone just asked if they could ask questions. Questions are not going to be asked during the presentations. We're going to kind of cruise through here, and we will all be available after the meetings to answer any of your questions. So keep note of that, maybe jot a little note, and we'd be happy to answer it then. Plan 2 has also great prescription drug coverage. It's either 10, 30, 60, or 25%, depending on your prescription drugs, where they fall in. There is a donut hole on this plan. However, when you're in the donut hole, generic drugs are covered with a flat copayment, and there's brand manufacturer discounts. So it's kind of nice. You can continue to absorb some of those costs, and it's a very cost-effective plan. This also includes the 3-month supply for 2 copayments at preferred pharmacy or mail order. We have a fitness program. Has anyone heard of Silver Sneakers? I hear about that all the time. Silver Sneakers is great, and they have 13,000 locations nationwide, so they're very, very large. And this is a free membership to one of their locations. You can look online on their website or call us. Some of them are YMCA, LA Fitness, SNAP, YWCA, Curves, and new for 2019 is Lifetime, but just the bronze and gold clubs, not all of them. So the bronze and gold. So that's great, that's a free membership. If you are going to a club that is not part of Silver Sneakers, we have our health club reimbursement program, which gives you $20 a month off of your membership. So if you're going to a Lifetime that's not a bronze or gold, you can continue to do that and get that $20, but just not the free membership. Doesn't matter how often you go, how much or how little, you set your own fitness goals. We don't have any requirements under that. Additional services, we have some disease management programs, and it depends if you fall in one of these categories, you'll get some information and get contacted by our care management team, so look forward to that. We have a member health advocate, which will deliver some educational phone message to targeted members on a variety of issues. And then we also have Matrix, which is a free voluntary, and again I say voluntary because I have people call me and say, do I really need to do this? No, you don't, but it's free and it's a great resource. They'll come out to your home and they'll do an assessment. And they'll tell you, my mother-in-law had this done and they told her, get rid of those rugs, change this, and it just gave her some good ideas of some things to do and helped her with her medications a little bit too. So it's just a resource that's available to you once you become a member. Value, Medicare Advantage and UCare Value. One of the things is there's one card We take care of all the paperwork. There's no bills or claims or forms for you to deal with. We take care of your Medicare Part A, Part B, we are your Part C, we add your Part D, the drug plan, and we work it all together and coordinate it for you. You just show your UCare card when you go to a provider. So it's very easy and simple, and we take care of all the claims and billing for you too. One of the things that's nice and unique about our plan is under skilled nursing facility care, which is a temporary situation in a nursing home where you're having skilled care. We do not have the 3-day hospital stay. And that's unique to UCare. Many plans do have that. Maybe you fell down and broke your hip, and you're only in the hospital for a couple days. You're not there for 3 days. And you need to go have some skilled care taken care of at a rehab service. You can do that with UCare because we waive that 3-day hospital stay. So that's one of the things that's nice about our plan also. And again, as I say, the group plan allows richer benefits, and I really encourage folks, when you're talking to a friend or relative, to remember that you have your plan through an employer group, not an individual plan on the open market. How do you join? Retirees and spouses, we have enrollment folders out front, or we would mail them to you. You each need to fill out an application when you retire and when you turn 65, and there's also a choice form that you need to fill out letting us know if you want Plan 1 or Plan 2. And then you can mail it back in the envelope that's provided. What happens once you join UCare, you'll get confirmation of enrollment. You'll get your member ID that looks similar to that. It'll be a little bit different. Information about customer service and the phone numbers on the back of your card. And we have our UCare 24/7 nurse line that you'll have information on too. You'll get some information when you become a member on our disease management program, so that'll all be in your new member packet. And you also can set up your own member portal at ucare.org where you can look up information, ask questions, find material. So it's a really nice resource if that's something that you're interested in. If you have questions, and as Ryan had said, if you have questions about our plan, call us. We have phone numbers. You can also email us, or we encourage you to stop by and visit us. We're right in Northeast Minneapolis. We have lots of folks that stop by and visit us, so please feel free to do so. Thank you, and thank you for letting us continue to be part of the University of Minnesota, to be offering a retiree plan. We're excited. We love being here. We'll be at the next retiree meeting and at the open enrollment benefit fairs. But again, we just want to say thank you, and I encourage everybody to stick around and get all your questions answered from all the carriers after we're done here. Thank you. And I think we have health partners.
Hi, and welcome. My name is Linda Straub, and I am with Health Partners. I specialize in group Medicare, and I think I need to change Health Partners. Okay. I am excited to be here to help explain what is happening in your world. We'll go through 3 sections. With the most of our time spent on the changes in Medicare and how it will affect you. There we go. A quick review of who Health Partners is. How many of you have been with Health Partners for 30 plus years? Show of hands, quite a number of you in the room. Well, we've been around for more than 60 years as a local integrated health system. We provide care through our clinics and hospitals, as well as provide insurance. That is unique in the marketplace. This gives us a more complete picture of our members to help with the preventive services. And this is our mission. We have over 26,000 of us practicing this mission every single day. A quick review on the ABCs of Medicare. As you know, as being a current Medicare member, Part A is the hospitalization or the inpatient part of Medicare. Part B is the doctor, the outpatient portion of Medicare. You do need to have Parts A and B in order to be on a Medicare supplemental type plan, such as offered through the University of Minnesota. Part C is the administration of these Medicare benefits. and this is done by private insurance companies. The Medicare Advantage, the Medicare cost plans, supplemental plans, and of course all the group plans fall into this category. And of course there's Part D, which is the prescription drug plan. If anyone would have questions regarding the Medicare plans, I'd be happy to talk to you and give you a little bit more review of how Medicare works. But because we really want to get to why it is you are here, let's get to that. Okay. As you may have heard, the Medicare cost plans are going away in most of the counties in Minnesota. Based on federal law, most of the counties will no longer be able to offer Medicare cost plans. And that is due to the fact that in counties, there has to be at least 2 Medicare Advantage plans with a certain number of membership in it. And then the cost plan would no longer be able to be offered in those counties. The good news is the University of Minnesota and Health Partners have an option for you. As I've talked to previously before we started, a number of you are on the Freedom Cost Plan with Health Partners, and so this you'll want to pay attention to. Don't worry. You will be taken care of automatically. What's going to happen is that those of you residing in the remaining cost counties will be able to stay on the Freedom Plan. Although most of you here today, I would gather, live in the Twin Cities metro area in counties where the cost plan will be going away. You will automatically be enrolled in the same plan that you are enrolled in now, Plan 1 or Plan 2, automatically into the Medicare or the Journey Group plan through the University of Minnesota. The rest of you will have the Retiree National Choice Plan available to you, and we can get more into the 3 different types as we go along. Don't worry. We do have a number of resources for you because this is a lot of information coming at you so fast. So Health Partners does have specific resources that will help get through this transition period. I would encourage you to go to the Health Partners website, healthpartners.com/Medicare changes, and you'll get a lot of information there regarding the cost plan transition. Now, let's get to the nitty-gritty of what all of this means to you. One thing to keep in mind is all of the plans offered through the University of Minnesota with Health Partners have medical and prescription drug plans together. I will talking about all three types of plans, and Plan 1 and Plan 2. They will remain the same 2018 to 2019 as far as co-pays go, but they each work a little bit differently. Now, something very important to remember is that the plans offered through the U with Health Partners are determined by your county of residence. I know I've said a couple of times, but I just want to make sure that I'm clear. It's based on county of residence. So remember when I said there will be certain counties that will be allowed to still keep the cost plan? These would be the counties. Is there anyone here that would live in any of these highlighted counties? Not too many. But this would be primarily in the northern part of Minnesota or some of the counties in the southern part of Minnesota. If you live in or know of anybody that lives in one of these highlighted counties, you will remain on the plan that you currently have. Health Partners was awarded, again, the 5 stars for 2019. We're very proud of that. It's based on our Freedom Plan. And the 3 out of the last 4 years, we have been awarded the 5-star plan. Now for the Journey Group plan. This is the plan that will impact most of you here today, so you will want to listen to the next few slides. If you live in one of these counties, Anoka, Benton, Carver, Dakota, Hennepin, Ramsey, Stearns, or Washington, the Journey Group Plan is what the plan is you'll be automatically enrolled into. How many of you live in one of these counties? Yeah, just about everybody. The Journey Group Plan does have a local network that you must use for the highest level of benefit. This network primarily consists of health partners, Park Nicollet clinics, and other associated specialists and hospitals. The good news is that most of you already are using this network. Health Partners did an analysis along with the University of Minnesota of what providers you are all going to. And like I said, most of you are already using the Journey Group Network. So that's awesome. You won't have to change your doctors. However, there may be some of you that will have to make a choice to change doctors. A couple of options for you would be to access our out-of-network benefit for those particular doctors that you might see occasionally that you don't want to give up. There is a safety net for you for a little bit of peace of mind. Now, for anyone, we don't want to leave out those that are lucky enough to permanently move outside of Minnesota to a warmer climate. So for those of you who don't live in the remaining cost counties in Minnesota or Wisconsin, or that don't live in the Journey Group counties here in the metro area, the Retiree National Choice Plan is what you will be automatically enrolled into. This is a great thing that the U has provided, that we've worked with the U to provide the same level of benefits no matter what plan you are enrolled in. The benefits are the same. So with each plan type, there are still two options to choose from. These are conveniently named Plan 1 and Plan 2. Remember that no matter which plan, which type you're on, the Journey Group Plan, the Freedom Cost Plan in those remaining counties, or the Retiree National Choice Plan, the benefits are the same. So as you can see, the same routine exams are covered under both plans at 100%. That's no change from this year to next year. Doctor visits will remain the same at $15 under Plan 1, $20 for primary and $30 for specialists under Plan 2. Some of the other options that aren't listed would be outpatient surgery, for example. Under Plan 1, that is covered at 100%. Under Plan 2, it would have a $75 copay. Ambulance, if you're on Plan 1, it is still covered at 100%. Under Plan 2, it would be at 20%. Physical therapy and occupational therapy will remain the same at $15 under Plan 1 or $30 under Plan 2. And don't forget that under the Journey Group Plan, you do have access to out-of-network benefits. It is a 60-40 coinsurance, and what that means is that we at Health Partners would pay 60% of the cost, and you would pay 40% of the cost. This is a great peace of mind safety net that the doctor that you might see that's out of network, you can still choose to see. As with the medical benefits, staying the same, the prescription drug benefits are staying the same. So the same level of copays depending on what tier you're in and what plan design you are in, the copays will remain the same. Keep in mind that a big plus with a group plan is that there is no coverage gap or donut hole. You pay the same level of copay throughout the year. This is a great plus for a group plan such that as the university has offered to you. So again, as Debbie said, if you're talking with your neighbor that may have different premiums, different copays, this is because you are in a group plan. For even more convenience and savings, you can use our mail order and get 3 months supply for a $2 copay. Now, some of the things that go above and beyond Medicare are listed up here. We have an excellent personal support system and member service team at Health Partners. a 24/7 nurse line that you can access at your convenience. We have the exercise program, Silver and Fit. How many take advantage of the health club membership? A number of you raised your hands. Who would really like to have their gym membership paid for free? That would be awesome. So under all three plans, the Silver and Fit program is included in this benefit as a no-cost gym membership to you. Silver and Fit is a national program, so as you're traveling, you would be able to find a gym nearby that you could take advantage of that. There is no annual or monthly fee under Silver and Fit, and there's no minimum required number of visits under Silver and Fit. We also have an online account. How many use the online payment system or see your claims? That is still available under all three plans as well, so no changes there. Now, what's going to happen next? You will get a letter from Health Partners that is a required Medicare letter. So just imagine what that's going to look like. But bottom line, there are really two things that they're trying to tell you. One is that you will be disenrolled from your Freedom Plan, and two, you will be enrolled automatically into the plan based on your county of residence. So you can expect that up the next couple of weeks. If you have any questions, there'll be a phone number there to answer, but that's basically what the letter is trying to say. And so in December, okay. So then, after you've received that letter, you're automatically enrolled into the plan that you are eligible for based on your county of residence. Plan 1 members will go into Plan 1. Plan 2 members will go into Plan 2. This is the time of year, as Debbie said, that you can make a change from one plan to another, and that is using the form in the back of the booklet as it has been for years on making plan changes. In December then, you will receive your new member materials. This will include a new ID card to use beginning January 1st of 2019. There's been a lot of worry and a lot of anxiousness out in the marketplace with all of the advertisings that you've heard and radio and TV about the cost plan going away. Don't worry. I know this has been a lot of information for you, gone through very quickly. I will be available afterwards. Come see me by the table. I do have a colleague with me, Jody, and we would be able to answer any of your questions then, so see us. Don't worry, you don't have to do anything. With that, thank you.
Good afternoon, everybody. My name is Stacy Alness, and I am the account rep for Medica. So today we're going to be talking about the plans that Medica has available through the University of Minnesota. All right, so as we've kind of all said, the reason why most of you are here today is because we are having some changes in our market due to the Medicare cost plans going away. So effective January 1st, 2019, most of you will be losing your Medicare cost plans. And those counties that are going to be impacted are 66 counties in Minnesota. And so your Prime Solution plan will continue through the end of the year, but starting January 1st, we will be auto-enrolling you into a new plan design if you are currently living in one of the 66 impacted counties. If you're in one of the remaining 21 counties in Minnesota, so the counties that are highlighted in green up there, those are the 66 counties that are being affected by this cost plan transition, and the counties that are highlighted in white will remain Medicare cost plan counties, as well as South Dakota, North Dakota, and Western Wisconsin. Those will also remain Medicare cost plan counties as well. So this is just a list of the counties that are being affected by the transition. The top ones are the Medicare Advantage counties in Minnesota who will have to move from a cost plan to a Medicare Advantage plan. And the counties on the bottom are the counties that will, the 21 counties in Minnesota that will remain Medicare cost plan counties. So in order to be eligible for one of the Medicare Advantage plans that Medica is going to be offering in 2019, same thing, you still have to have your Medicare card with both Medicare Part A and Part B on it. You still have to continue to pay that Part B monthly premium, so that's not changing at all. You still have to continue to pay that. And with Medica's Medicare Advantage plans, you cannot have end-stage renal disease prior to enrolling in our plan. If you are coming from a Medica plan, no worries. You don't have to, if you have end-stage renal disease, we'll still automatically enroll you into a Medicare Advantage plan. Or if you're coming off of the active U of M plan with Medica, you can still enroll in our Medicare Advantage plans even if you have end-stage renal disease. And then you do have to permanently reside in one of the 66 counties that will now be becoming Medicare Advantage counties in 2019. And then in order to be eligible for one of our Prime Solution cost plans, same thing, still have to have your Medicare card with A and B on it. You still have to continue to pay that Part B monthly premium. Once again, can't have end-stage renal disease, and you have to permanently reside in one of the Medicare cost plan counties. So one of the 21 counties in Minnesota, either in North or South Dakota or Western Wisconsin to continue to be eligible for the Medicare cost plan in 2019. All right, so with the U of M and Medica, we have two plan options to choose from. So we have a high option plan, which is listed under the Medicare cost plan group number in 2018. So most of you, if you're on the Medica Prime Solution cost plan, you'll recognize that group number of 70521. In 2019, we're going to call that Plan 4, or in the U of M booklet, it'll be your Option 1 plan. We're going to go away with the group number, using group number 70521, because for most of you who are going to be moving to a Medicare Advantage plan, you are going to have a new group number. So you won't be on group number 70521. In 2019, we'll be having a new group number for you. So we're going to go to using Plan 4, which is going to be Option 1 in the U of M booklet. So as you will see, Medica has chosen to keep the premiums and the benefits the same for 2019. So in all this constant commotion that we're having with the Medicare cost plans going away in majority of the counties in Minnesota, we wanted to keep things as stable as possible for our members, our groups, for us at Medica, to try and keep this transition as easy and smooth as possible. So we kept the premiums and the benefits the same for 2019. So it doesn't matter if you're on a Medicare Advantage plan or a Medicare cost plan, these are going to be your benefits and your premiums. So on our high option plan, the plan number 1, you can see that there are co-payments for services like your office visit, specialist visit, inpatient and outpatient hospitals are covered at 100% on this plan. This high option plan offers you a low max out of pocket of $1,000, so that's the most you'd pay out of your pocket in a calendar year for medical services received. And with this plan, prescription drug coverage is embedded with it. So actually with both plans, the prescription drug coverage is embedded with it. But the reason why this plan has a higher monthly premium than Plan 2, the lower premium plan, is because of its extensive prescription drug coverage. So with this higher option plan, you're going to pay co-payments for Tier 1 through 5 medications, and you'll continue to pay these co-payments all year long, regardless if you're in your initial, if you're in level 1, or if you're in that coverage gap that we all hear about, you're not going to be subject to the co-insurance that most of the people out in the individual market are subject to, because this is a Medicare group plan. offered through the U of M. So it has much richer benefits in that coverage gap where you're only paying co-payments versus co-insurance. And then also, if you're somebody who hits that catastrophic coverage, once again, you're not going to be subject to that co-insurance. You will continue to pay these co-payments all year long. So that's why you have a higher monthly premium than some other plans, is because of that rich prescription drug coverage. And then we also have the lower premium plan, which for most of you, if you're on this plan, you have a group number of 70176. This is going to be going to Plan 7 in 2019, or Plan 2 in the U of M booklet. And for this plan, it does have a lower monthly premium, so you're going to have a little bit more cost sharing. For doctor visits, your primary care, $20 copay, specialist, $30 copay. So there is some cost sharing, but it's very manageable cost sharing. The real big difference between the higher option and the lower option plan is in that prescription drug coverage. Whereas if you were to fall into that coverage gap, that donut hole, on the lower option plan, Tier 1 and Tier 2 medications will continue to be covered with a co-payment. But brand name medications will be responsible to that 25% co-insurance. And then if you're somebody who falls into the catastrophic coverage, you'd also be subject to the co-insurance. So there is more out-of-pocket exposure on the lower plan option, hence the reduced premium amount. But if you are enrolled in either one of these plans and you want to stay with this plan for 2019, you don't have to do anything, because we are going to auto-enroll you into this exact same plan design onto a Medicare Advantage plan type for 2019. So you don't have to do anything. We'll automatically enroll you into the current plan type that you are in today if you'd like to remain on this plan. And the nice thing about the Medica plans, the Medica Advantage plans for 2019, Medica has made the decision to have our in and out of network benefits the same. So if you are somebody who chooses to go to a provider who is not in the Medica network for 2019, as long as that provider accepts Medicare assignment, you can see whoever you want. You don't have to, you can see whoever you want, because in and out of network benefits are treated the same, so you'll still have these co-payment amounts as long as that provider accepts Medicare assignment. And in order to verify if they accept Medicare assignment, you can either ask when you call and make an appointment, or you can go out to Medicare.gov, and they have a provider lookup tool that verifies who is in the accepts Medicare assignment. So a really nice benefit with these plans is that in and out of network benefits are the same. And then, like I stated earlier, the prescription drug coverage that is embedded with the medical plan. So don't go enroll in any other Part D plan out in the market, because it will kick you out of your medical and your Part D plan, because it is bundled in there. And so you can view Medica's formulary on our website at medica.com. This will not be available until October 1st. So the 2019 formulary will not be available until October 1st. Same thing with our provider directory. Excuse me. That will also be available October 1st as well. And so with Medica, our formulary, we have over 3,200 medications, so you can pretty much get your meds wherever you want. And you can go to any local pharmacy and get a 3-month supply for 3 months copay. But we do have a mail order program through Fairview, CVS, where you can get a 3-month supply for 2 months copay on your medications. And then we do have some value-added benefits that go along with our plans. So the first one is our fitness program through Silver Sneakers. So Debbie explained Silver Sneakers a little bit, but this is a free membership to any of the clubs that participate with Silver Sneakers. And there are a lot of different clubs that participate. A few examples our YMCAs, YWCAs, community centers, and new in 2019 is Lifetime Fitness, yay. I know that will make some of these members very happy. And this is a national program, so you can, if you're somebody who likes to spend 6 months in Florida, Arizona, you can go to any club that accepts silver sneakers. And then we have our 24-hour, 7-day-a-week registered nurse line, as well as our 24-hour, 7-day-a-week personal health advocate line is available as well. And then our personal plans portal. So once you become a member with Medica, you can set up your username, password, and then you have access to our information, and you have access to your claims data. If you lose your ID card, you can order a new one. Lots of information available for you. So, what to expect next? So if you are somebody who's going to be transitioning onto a Medicare Advantage plan, we are going to do that for you, so you don't have to do anything. So we are going to send you an acknowledgement letter. It's going to be like a notice of change letter. And included in that notice of change letter is going to show you your 2018 benefits versus your 2019 benefits. And it'll include in summary and benefits with that letter, as well as your evidence of coverage for 2019. And this will be mailing somewhere around October 15th-ish, so you should be getting it definitely within the second or third week of October. Definitely before November, you'll be getting this information in the mail and explaining what your benefits are going to be for 2019. And then in December, we will be sending you out a new ID card, and with that new ID card will also be a new group number. So just note that you will be getting a new group number if you're moving on to a Medicare Advantage plan. And then we'll be having a verification information letter as well as a confirmation letter as well you'll be receiving before the end of the year. And if you're on the Medicare cost plan, it's business as usual. There will not be any sort of changes. You'll get your annual notification of letter, which you have gotten in the past each year at this time. You will also be getting a new ID card in December. However, your group number will not be changing. You'll get a new ID card in December, and then your member renewing kit, which you usually get every year around the December timeframe as well. So with Medicare, if you're staying on a Medicare cost plan, it'll be business as usual. You don't need to do anything. You'll keep your same group number. Still need to use the same network of providers that you've always used under the Medicare cost plan. Nothing changes with that. So, thank you for having Medica be a part of the U of M. We are happy to be here, and do feel free to give us a call if you have any questions regarding this change. I will be out in the room, back in the room at the end of the presentation if you have any questions, but always feel free to call our customer service center with any questions that you may have. So thanks for having me today, and don't worry, we'll get you taken care of, and if you want to stay with your Medica plan, you don't need to do anything. If you want to enroll with into a Medica plan for 2019, work with employee benefits, and we will get you enrolled into a Medica plan in 2019. Thank you very much.
Good afternoon, everybody. I'm Nancy with Blue Cross and Blue Shield, and I'm going to talk to you about our two plans, Plan Option 1 and Plan Option 2. To get started, this is what I call kind of the Did You Know segment, that more than 32,000 Minnesotans are eligible and choose Blue Cross for their Medicare programs. And did you know that Blue Cross has been around for 85 years, and we've had the Medicare plans in place since 1965. The plan that I'm going to talk about first, Plan Option 1, has actually been in place for 32 years, so that's just a little added information. We invest in the communities we serve, not just our members, and we'll talk a little bit about that. And 1 in 3 Americans are Blue Cross Blue Shield of Minnesota, or Blue Cross Blue Shield members. So what I'm going to talk about today, I'm going to talk a little bit about Medicare in general, just a little refresher, and then I'm going to talk about Plan Option 1 and then Plan Option 2. So I'm going to separate them into 2 different sections. So you already know that Medicare A is your inpatient hospitalization. So that's not anything new to you, but it's always good to have a little refresher. Part B is your physician services. So if you're going to the doctor for any services, a lab charges, anything like that, is going to be Part B. Part D is your prescription drugs, and Blue Cross will enroll you into the prescription drug plan as part of whatever plan you choose. So your Part D is your drugs. And a couple of things that Medicare does not cover, and why you're all here today, because you want to get some supplemental coverage, because Medicare is not going to cover everything, are some charges beyond what Medicare covers for your inpatient and skilled nursing facility charges. Also, it does not cover routine vision and hearing screenings. It doesn't cover most care outside of the United States unless it's an emergency situation. And then if there's prescriptions that are not covered by A or B, it does not cover them. So that's why you're put into Part D. And also, original Medicare does not have an out-of-pocket maximum. So once you keep going, it could really add up. So first of all, I'm going to talk about Plan Option 1. I've had a lot of people stop at the table already today asking me about Plan Option 1. This is the plan that's been around since 1986. And I know that people are questioning whether or not this plan is changing at all. It is not. This is going to be the rate, $346.50. If you're enrolled in Plan Option 1 today, you don't need to do anything. We'll automatically keep you in the plan for 2019. These are the 3 cards that you would be using when you go to the doctor. You're going to have your Medicare card for Medicare A and B. You're going to have your medical card for Blue Cross. And then you're going to have a Medicare D card that you'll be using for your prescription drugs. This is U of M Plan Option 1. This is the plan that's been around for a long time. The way that this plan works is you do satisfy the Medicare B deductible, which is going to be $183 in 2019. So you'll pay that on the first claim that comes through. And then after you satisfy that Medicare B deductible, then you don't pay anything more for any of your physician charges. They're covered at 100%. So anytime that you go to the doctor after you've satisfied that, it's going to be no charge to you. Also true of your preventive care. Those preventive care services do not apply to the Medicare B deductible. They just are paid at 100% coverage. And then inpatient hospital care, you do have a $100 deductible, and then it's paid at 80% up to an out-of-pocket of $680. So even if you're admitted to the hospital more than once a year, the most you're ever paying for any inpatient care is $680 per year. Emergency coverage, after you satisfy that Medicare B deductible the one time, then that's also covered at 100%. Your medical supplies are 80-20 coverage. You pay 20, we pay 80. And then same thing for hearing aids. We pay 80%. And there's coverage for replacements of the hearing aids every 3 years. And that covers your supplies as well. There's no referrals needed with this plan. You can go any place you want. It's a worldwide plan. You can live anywhere in the United States. You can live in another country if you want to live in another country. We don't care if you move around. You don't have to report into us. Just go any place you want. We recommend that you use a Medicare certified provider, but you're open to use any Aware provider in Minnesota, and that's the largest network in Minnesota. Or you can travel outside the state of Minnesota and go to another state and use the Blue Cross National Network. That's available to you. Or worldwide, you can go to the Blue Cross Global Care Network, and you can use providers in 170 different countries. That's all open to you as a Plan 1 member. If you're interested in finding more information, you can go into the bluecrossmnonline.com and register as a member, and then you can look at your own claims. You can see where you're at as far as your deductible. Have I met my deductible? Where am I at? You can look at your doctors. If you want to try and find a doctor that's in the network, you can certainly do that too. And then there's a lot of wellness information out there as well. So you feel free to log in as a Blue Cross member. If you've got questions, then this is the customer service number that you would be calling. Let's talk about the drug plan that goes along with plan option 1. So the group Medicare Blue Rx is the plan that we use that is combined with your plan 1. So you're automatically enrolled. If you're enrolled in plan option 1, we enroll you into the D. More than 67,000 participating pharmacies nationwide. So all of the big ones and a lot of the mom and pop shops are all part of this. There's no deductible, there's no coverage gap, no donut hole. You can get 90-day supply for two copays available through mail order and some retail pharmacies, and I can help you with that. And then there's medication therapy management programs as well, if you're part of the Medicare D plan through Blue Cross. This kind of gives you a little bit of a summary on how the prescription drugs work. It's a 10, 30, 50, 50 copayment option, and then there's the mail orders to the right of that. And it just kind of explains kind of how all the plans work. I won't go into the detail of it. If you've got questions about the Medicare D plan, then you can call this customer service number or look at MedicareSolutions.com online, and you can find your drug formulary, you can find your pharmacies who participates, all of that information is there. I've got some handouts at the table outside that you can pick up one of those, and it gives all this contact information on that handout. Included in plan option 1, there's some complimentary services and discounts. You do have a fitness discount program. It's the $20 if you go 12 times a month fitness program. There's vision and hearing discounts from our Blue 365 discount program. Again, you can find that online. There is a nurse line that's 24/7, and there's a great quit tobacco program if you're interested in that. In order to enroll in the plan option 1, you of course have to be enrolled in Medicare A and B. That's all part of it. And then we will automatically enroll you in plan D. And in order to do that, you're going to complete the U of M medical enrollment form. You're going to turn that into the university. They're going to send that to us, and we can send you out a kit if you're interested in getting some more information. This tells you how you should go about completing the forms that are included in that kit. Let's talk a little bit about plan option 2. So plan option 2, those of you that are enrolled in the Blue Cross plan option 2 at this time, it is a cost plan, and that cost plan will be going away. Blue Cross will not be offering a cost plan to the U of M members. We are changing it to a Medicare supplement plan, and I'll talk a little bit about how that Medicare supplement plan will work. If you're enrolled today in the cost plan with Blue Cross plan option 2, we'll automatically enroll you into the Medicare supplement plan. That will happen automatically for you. Again, you're going to be using 3 different cards, your Medicare card, your Blue Cross Blue Shield medical card, and then you'll also have a Medicare D card. The plan option F, which is also known as a high deductible plan, has guaranteed renewable benefits. It's portable within the United States. With this plan, you can live anywhere. You can live any place in the United States that you choose to live. You can move back and forth. We don't care where you live. So you're not locked into Minnesota. You don't have to be a Minnesota resident. You should use any Medicare contracted provider for your services. There is worldwide emergency coverage, so if you're traveling overseas and you do have a situation, that is covered under your plan. There is protection for you if you have catastrophic expenses. It has preventive care coverage, and Silver and Fit is the exercise program that's included in this plan. This is kind of a little sheet on how it works. It's called the high deductible plan because you're going to meet the high deductible up front. And the high deductible is $2,240, so you're going to be paying that up front. So as a claim comes through, and if you are paying a certain amount, it's going through Medicare first as their primary, and then it comes through to Blue Cross, and if you owe $185 on that claim, you will be paying that. That will be going towards your deductible for the Plan 2. So once you've accomplished that $2,240, whether it's an inpatient claim or whatever the charges may be, then you're going to pay nothing after that. That's how it works. So it's deductible up front. So any preventive services, that would be covered at 100%, zero to you. Inpatient charges would be covered in full after that. Your emergency and urgent care is covered in full. Your emergency worldwide benefit, that is a 80-20 benefit, so you would still pay 20% of that. And then durable medical equipment also would be paid at 100% once that $2,240 is satisfied. This is kind of a little example. So Jim had an inpatient hospital stay, and he's responsible for his Medicare deductible, his Medicare A deductible, because he's inpatient, of $1,340, and any other Medicare Part A coinsurance until the high deductible is met. So as I explained, once you satisfy that high deductible, then it's covered in full. Same thing if he's going outpatient, so he's going to the doctor and he has an office visit on January 1st, so you just enrolled, he has to go to the doctor. He's responsible for the $183 Medicare Part B deductible, and then any coinsurance in addition to that applies to your deductible, so you would be paying for that out of pocket. If he went back again and he went to the doctor and it's another $100 and he hasn't satisfied his deductible, you're still going to be paying that $100. So I just want to make sure you're clear on that. With the Plan 2, there are some options with it that are included in the plan. So you have a choice of fitness programs. You can either do the Silver and Fit, which you've been hearing about today, or there's also a healthy aging program that you can enroll in. The vision and hearing discounts that are available are through Blue 365, which is Blue Cross's discount programs. There's a lot of wellness information out there, a lot of discounts on vitamins and that type of thing. You'll find that out under the Blue 365 website. There is a nurse line included, so a 24/7 nurse line. So if you have any services or any conditions going on in the middle of the night and you need to call a nurse, you have that included in your plan, and a great quitting tobacco program again. Under the Plan F, this is where you would dial in. If you are going to be calling customer service, you would call this number. If you want to register as a member and go online and take a look at your claims, again, same thing, you can find your doctors out there. You're using the same large network across the United States, and once again, you can live anywhere with this plan. This is how the prescription drug benefits work. It's a 10, 25, 60, 25% benefit, and then there is a mail order benefit in addition to that. There is no coverage gap. The coverage gap is filled. This is the customer service information for the drug program, and again, it's on the back of my form out there, so if you want to pick up a form, you sure don't have to write this down. Customer service, and then the online email address to get into your Medicare Part D information. And then this is your instructions if you're going to be enrolling in the Part 2 or Plan 2. Then you're going to get an application from the university. You're going to turn that into Blue Cross. We'll send you out a kit. It'll have your enrollment forms in the kit. You're going to complete them, return them in the postage paid envelope back to Blue Cross. It will get you enrolled in Plan 2, and you'll get your cards and your plan information in the mail. I just want to remind you that we do have Blue Cross retail centers across Minnesota, and there is one right in Roseville, and another one in Edina. So if you've got questions, that's what they're there for. Use them. Go in there, and they're very educated on your plans, and they can help you sort things out too. So don't forget about that. And I want to thank you for joining us today, and we will be outside to answer any questions that you have. Thank you very much.
All right, that concludes our vendor partner presentations. Just a quick wrap up for everyone. I've been talking to people about benefits for a long time, and if you are considering a plan change, two of the things I always tell people to check into is If you are set on the doctors you're using currently, make sure your doctors are covered under the new plan. The other thing is if there are certain drugs you need to have, make sure you know that your drugs are covered under your new plan. So that's just, those are two things that I always tell everyone when they're looking at changing a plan. Open enrollment for us will be November 1st through November 30th, so please get your forms into us earlier, the better, so that we can contact the vendor so they can send you the application you have to fill out for them. And then finally, I just want to say thank you. I do have to say, through this whole presentation, I kept thinking of Thing 1 and Thing 2 from Dr. Seuss every time I heard of Plan 1 and Plan 2. I was thinking we should change our logo for our plans to something more like the Dr. Seuss Thing 1 and Thing 2. But thank you very much. It's great to see the turnout. Please join us outside to get some specific answers you may have, or specific questions answered for yourselves. Thank you.